All right. I think we are ready to go on this end. Jen, are you okay over there?
I am. Can you hear me okay?
Yep, you sound good to me here.
Good.
All right. Well, thank you for joining us tonight, everyone. My name's Rob Hatton. I'm the communications manager with Grey County. Also on the line tonight is the star of the show, Jennifer Cornell, our director of long-term care with Grey County. I will pass the floor over to her in a moment here. I just quickly want to go over some housekeeping things for tonight's info session. I imagine most of the people on the line have been on one of these calls with us before, so I will be brief. Jen is going to give a brief update tonight on some of the changes since we have last spoke, and we'll provide an update on Grey County long-term care homes. Once she's done doing that, we will open up the floor to questions and answers. For those of you joining us on Zoom tonight online, you will see that you have the Q&A option on your screen. It'll be on the top if you're on a tablet, on the bottom if you are on a laptop or desktop device. And if you have a question, please enter it in there. It helps make sure that we do keep track of these and we don't lose any, and we'll get to as many as we can. We have about an hour this evening to get through these. Unfortunately for our people that are calling in tonight, we won't be able to take any questions from you. But if you do have something that we're unable to answer tonight, or if you think of something after the call, please email it to communications@grey.ca, and I'll work with Jen and make sure that we get a response back to you as soon as we can. And one more thing I'm just going to share here. I do just want to remind everyone that our call tonight, this video discusses matters related to residents of Grey County's long-term care homes during the COVID-19 pandemic. Please feel free to share this video with others in the Grey County community. If you have a family member in long-term care that's not operated by Grey County, please contact that home directly if you have any questions. And with that, I will send it over to you, Jen.
Okay, great. Thanks, Rob. I didn't even send a memo about coordinating outfits, so I'm glad that worked out the way that it did. All right, I'm just bringing my notes over. So nice to see all of you on the line. I can see your names. As Rob said, who I am. So we met last virtually on September 28th. There has been ongoing and continuous updates from the province and the Ministry of Long-Term Care and Public Health since then. We continue with our infection control, staffing, and PPE strategies. And as of today, there continues to be no positive cases of COVID-19 in any of our 3 homes. We are very much in the middle of the second wave of the pandemic, and we are seeing COVID cases increasing locally and across the province. Grey Bruce has moved into level yellow for public health strategies and restrictions. The purpose of our call tonight is to provide an update and to reassure you that we are doing everything we can to keep your loved ones safe while continuing to color it for them every day. On this call, I'm going to provide some updates on the provincial response framework, so that yellow, green, or green, yellow, orange, etc. Give an update on the designated care partner program and an update on testing. Okay, going to talk about outdoor visiting, some IPAC funding that we received, a little bit about Christmas plans and preparations, and then answer any questions. So getting right to it, we are, as I mentioned, we are seeing provincial numbers of cases rising daily. In our immediate Grey Bruce region, we're seeing an increase in COVID cases with 47 active cases today. We must recognize that there continues to be community spread, and we must remain vigilant in our strategies to prevent infection. Those strategies are our first line of defense in stopping the spread of the virus into the home. And just as I do every call, just a quick overview of the strategies that continue to be in place. Active screening, that's for every person, every team member, every visitor, any person that comes into the building. Active screening on the way in and way out. Staff are only working in one facility. We do continue our interval testing, and I'll give an update on that. We're minimizing the movement of staff from home area to home area within the home. All staff and visitors in the home are wearing surgical masks at all times, so that universal masking. All new residents who move in are tested for COVID prior to admission, and are isolated for 14 days and are also tested at the end of those 14 days before they come out of isolation. We do continue to have plans in place to quickly isolate residents if we need to, and we are also ready to move into a full outbreak protocol if we need to do that. We continue to monitor the PPE supply and we report that inventory to the province. So talking a little bit about level yellow and what does that mean? At the same time as the framework came out with the varying levels of strategies, the Minister of Long-Term Care also issued a minister's directive called COVID-19 Long-Term Care Home Surveillance Testing and Access to Homes. And that was effective Monday, November 23rd. This directive allowed us to move to mandatory testing for all staff. The new directive also requires DCPs and indoor visitors to provide proof of their negative test result. I'm going to share my screen. Let me just make sure I've got that up. So for those of you on the phone, you're not going to be able to see it, but I'll just explain it a little bit. Let's see. Okay, so are you able to see the chart, Rob? Yes, okay.
Yeah.
Okay, so this is a chart that came with that directive from the minister, and it just outlines what's required for the variety of people that are coming in and out of the building, depending on what restriction level or what level of protection we're in. So we are in yellow. So our staff, students, and we currently don't have volunteers coming in yet, but if we did, they are tested every 2 weeks, and that testing has been moved to be mandatory. Caregivers, which is our designated care partners, and other support workers or general visitors are now required to provide proof of your COVID test. And if we move into orange or red, all of those requirements shift from every 2 weeks to weekly. And we'll include this in an update when we send a kind of a summary out after. Now I've lost my notes, so I'm just going to grab them. So the teams have moved very quickly to provide all staff the ability to be tested whenever they are on shift. This testing is mandatory for staff and DCPs, and if someone refuses, they will not be able to continue working if they're a staff member, or if they're a DCP, they won't be able to continue supporting their residents until they are tested. And there may be some questions about that, and we'll come back to that. So I'd like to give you an update also on the Designated Care Partner Program. It is going so well. And again, I just want to thank everyone for all of your support on this. And I am going to share my screen again, but I need to make sure I have the right. I had a lot of things to share today. Okay, so just some highlights on the DCP program. So across the 3 homes, we have 326 long-term care residents. This was about a week and a half ago that we had this data pulled together, so it's maybe even more, but we have 345 DCPs that are registered. 170 caregivers, family members, are actively and safely supporting residents at the bedside in the home. I just think it's so wonderful. 129 people of the DCPs completed their education online on the Surge Learning platform, and the rest did a hard copy booklet. And again, a couple of weeks ago, we'd already done 190 COVID tests specifically for our DCPs. And I'll share that highlight too in the summary. This program, this Designated Care Partner Program, is really cutting edge and is helping to change the landscape for residents and caregivers in long-term care. Grey County, our teams have been asked to present our program at 2 provincial learning collaboratives and have recently received approval for a $10,000 grant through the Canadian Foundation of Healthcare Improvement to support the development of our program. CFHI has a long-term care plus acting on pandemic learning program, and it offers support and sharing of promising practices that have been implemented in long-term care all across Canada, and we get to be a part of that. So it's really exciting, and we wouldn't be able to do it without everyone's participation in developing the program and giving us feedback. And we've sent out surveys recently. So part of our evaluation process is to survey the DCPs. We've also sent surveys to staff and surveying our residents as well. And that feedback is helping us make the program even better. COVID testing is now available for DCPs at all 3 of our care communities. And if we move into level orange, where that testing is required weekly, we will also offer that testing weekly for DCPs. We will continue to offer a variety of visiting options in order to best meet the needs of you and the residents. And so there continues to be a large number of options. So virtual, which is FaceTime, Zoom type visits, window visits, outdoor visits, indoor, essential, which are those urgent, critical, last minute type visits, and then the designated care partner. We are working on some innovative solutions for winter weather and outdoor visits. So if you have any ideas, please feel free to send them along. We're looking right now at ways to make it more comfortable for the visitor that is on the outside of a window visit. How can we create a bit of shelter, make sure the path to get to the window is clear and safe to walk on? Are we able to add a little bit of heat? We have done some sourcing to look for some of those outdoor heaters, and we're competing with the restaurant patio market that is also trying to set that up for the winter. So we're working away at some solutions. Staffing and IPAC funding. So our staffing levels remain stable, and we continue to actively recruit in a number of our areas across the 3 homes. So registered nurses, personal support workers, food service workers, and the emergency support workers that help us support with the screening roles and supporting the nursing teams when we're shorthanded. And I never want to miss an opportunity to thank and acknowledge all of our staff and our team members. We had an opportunity to stop at each home last week for a physically distanced, screened, PPE'd gratitude tour. So the Grey County Warden, the CAO, and I had the chance to drop off a small token of our appreciation for each staff. And we had the opportunity to say thank you to some of the team members and ask them to pass on our appreciation to all. And I just, again, can't thank our staff enough for all that they have done and continue to do day in and day out to keep everyone safe and to color it for our residents. We along with all long-term care homes in the province, received some one-time funding in each of the homes to support infection prevention and control measures. We call it IPAC for short. And so that funding is available to us to support IPAC staffing hours, education, and training. And so we're working through the logistics of providing some mandatory IPAC training from Public Health Ontario for all of our staff. It will be web-based, and also adding some hours for registered staff specifically to support our IPAC initiatives. And so we'll keep you posted on that. This brings me to plans for Christmas. So we're all wondering what the upcoming holidays are going to look like. And the teams in the homes are working hard and will not disappoint. They are doing everything they can to make the holiday season festive for our residents and our staff. The homes are being decorated, plans are underway for Christmas events, including a dinner with all the trimmings. And the team sent me along some lists, and this is just a few of them. Christmas tree decorating activities and contests, Christmas photo shoots, physically distanced versions of a Christmas market to replace the bazaars and those Christmas events, small group activities with Christmas baking, making ornaments, caroling, gingerbread house making, Christmas bingo, special raffles, the Grandpal program. And that reminds me, we are also included in a program that United Way of Grey Bruce is supporting, encouraging people to write letters to seniors and residents of long-term care homes. So we're on that list. I've heard that Santa's going to drop by on Christmas morning at all 3 of the homes. They're planning outdoor Christmas concerts and year-end events. So watch your newsletter for photos and updates, and I'm sure there'll be the odd TikTok and video that we'll be able to send out as well. As for visiting or going out for the residents the week of Christmas, I think it's just too early for us to make any decisions about that. We'll plan for another call or newsletter update as things change and as we get closer to December 25th. It's just a bit too soon for us to predict what that might look like. So I think that is the updates that I have, and I saw a few questions coming in, so I'd love to see if I can answer some and get some feedback.
All right, thanks, Jen, for that. That was very informative here. So we do have some questions regarding the Designated Care Partner Program coming in here. So the first one is regarding travel. So can we travel to an area that is red, or I guess I would add gray, for medical appointments without it interfering with DCP visits?
Yes, so right now, based on some direction that we received from public health, because this question has been coming up, so for DCPs and for essential visitors, so people coming in for, let's say, end of life or some more urgent reason that they need to come in and they're not a DCP, if they are from one of the other zones, red, orange, red, or gray, at this point, you are still able to come in. The staff are going to talk to you, make sure that you have a good understanding of the requirements for PPE, help make sure that you donned all your PPE appropriately, and they'll help you get to your person's room. But at this point, it does not limit you from continuing that program.
Okay, great. Do I need to have proof of a negative test in order to come visit?
Yes, so that is new, and I'm glad that you asked because I wanted to give a bit more of an update on that. So that is new, and we recognize that it's not always easy to have a piece of paper with your proof, and the province accounted for that as well. So you are able to show your screen of your phone that shows your negative test, and or bring a printout. And if that's a challenge, we're working on having an iPad or a tablet or a computer at the screening table. And the screener will help you show you how to log on. And then you just need your health card number. You put your health card number in. We don't want that information necessarily, but we'll help you log on and navigate the system so that your screen will pop up and say, that this was the date that your test result was in and it was negative.
Okay, that's great. So we do have that system in place for showing proof now. That's good. You answered two questions with that one, Jen. Now, will the DCPs start visiting more than once per day? Many of us leave during meal times and would like to return later in the day or evening.
That is a good question, and I will take that back and look into it and respond with an answer to the broader group. And I'll make sure that we also send that out to the DCP group in case there's some DCPs not on the call.
Okay, thank you. So this individual had their first COVID test done at Lee Manor back in November 16th, and they haven't received a result yet. And they have been checking with public health who don't have a record of that test. What would you recommend they do at this point? And is that a normal waiting time?
No, well, no. And so the testing is one of those things that is evolving. The process and the system is evolving across the province, I think, and there's some hiccups here and there. And so we're working at trying to make that a smooth process for people. And I get that it's frustrating when you phone public health and they don't know about it. So I would suggest that you give Lee Manor a call, and Susan or one of her team members will be able to help sort out your specific situation. And so I need to, as we transition to needing proof and potentially weekly testing, we are working on making that process smoother from test to result. so that it's easier for people to know exactly where to look to get their results. It should be showing up on the site, but it's hard to say what went wrong there.
All right, well, Henry had asked that question. So Henry, please contact Lee Manor and we will certainly look into that for you. Okay. Are there any problems with a person coming from another province, for example, Saskatchewan? I'm not sure, for a visit, I assume.
Right now, I don't believe that there are restrictions in place from out of province. Like all of you, the rules change so frequently and it's hard for all of us to keep up on the changes. I don't believe that that's a restriction. I do think that it would be worthwhile calling us and having some conversations before you leave so that we know you're coming. We can have a way of getting in touch with you in case anything changes. We have supported visits from people from out of province, and that worked really well. We knew ahead of time. We had a chance to have a call and communicated by email back and forth. And that way we can let you know if something happens.
Okay. So we have a question from Pat. As a designated care partner, the feeling is that we are treated as a marginal nuisance. Can you comment on that at all, Jen?
Well, that's too bad. That is part of the program, is to be acknowledging and recognizing the contribution and care that caregivers do provide. And so it's never our intention for anyone to feel like they're a nuisance. So if it's something that, if it's a one-off thing and somebody was having a bad day, maybe we can kind of let that slide. But if it's something that you're feeling frequently, I think it's worth giving a call to the home, talk to the director of care, talk to the executive director, and because we want to support DCPs in feeling like they're part of the care team.
Mm-hmm. Do we have a survey or something live for DCPs as well, Jen? Would that be a good way to give feedback?
Yeah, that's a great idea. And there is a survey. It may have closed, but we talked about reopening it. So I'll follow up on that as well.
Okay. All right. With current testing every 2 weeks for DCPs, there will be a gap in test results. So we would not have a result past 14 days. Will the testing schedule change to ensure there's no gap?
So we are working on a different way of approaching testing. Since we've moved to, and we've just moved this week to mandatory testing for all staff. And I know that's something that's come up on calls before, that families feel that's a really good idea. And the province has now given us the directive that allows us to move to that. And so that's a lot of tests that need to be done. There's almost 200 staff at Lee Manor, over 100 at Rockwood, and just under 100 at Grey Gables. So that's a lot of tests to be doing in one clinic, a couple of days every 2 weeks. So we are looking at adapting that process so that testing can be available more frequently for staff during the week. And so we can look at the DCP scheduling as well. DCP clinics may still be a couple of days a week, but if there is a need for that to be expanded, we'll in a week or so, we'll be in a better position to be able to expand that, which I think would then address the challenges that you're facing.
Right. Is there any expectation that if testing does go to weekly, that the results would come in any faster?
Well, there's a hope that that's the case. So we are looking at what are the options available to support the logistics of that amount of testing, because that's 400 staff and about 200 DCPs across the 3 homes. So that's a lot of tests to process weekly. And the other reason we want to look at spreading all that testing out over a week is to not overwhelm the lab systems by sending a bulk of 400 swabs to be processed at the lab. So we are in discussion with what are the options for lab capacity, and how might that change if we move to weekly and now that we've moved to mandatory. So the hope is that the test results will come back within 48 hours. That's the goal of the province and the labs.
Yeah. Thanks, Jen. So Dave has a question regarding his situation. So Dave's partner works for the City of Toronto for Animal Services, driving around all day to take calls from the general public. She's complying with all the protocols in place there. She comes home after working 2 or 3 days at a time. Is he still able to come in and see his mother in the long-term care home?
As a DCP. So what we're doing right now and have been doing is when there's these special circumstance type questions, we encourage people to come forward and ask the questions, and then we do a bit of a risk assessment and see what's the level of risk. Is there any of the risk that we can mitigate? Is there anything we can make the risk lower? So I would encourage you to call the home, and the teams are available and willing to talk out the situation and help support. And the goal is our goal is the path to yes, and what does yes look like? So the lowest risk yes that we can get to is what we'd like to do. We're working on a tool, actually, a risk assessment tool, and we're hoping that this program that we're doing with Canadian Foundation of Healthcare Improvement, that they can support us in the development of this tool. And then we could share it with you, so it would be very transparent as to how we're making decisions in these special circumstance cases. So that's our goal. We're not quite there yet.
Okay, thank you. So this one is a little more specific regarding the testing windows. I don't know if you have that in front of you there, Jen. So I've been testing every second Wednesday at 12 noon with pre-scheduled times, and I've been visiting within those 14 days up to 12 noon on the Wednesday 2 weeks later. I've always been within those 14-day timelines, that being noon Wednesday until noon Wednesday 2 weeks later. My test result reads November 11th, but it doesn't read the time of 12 noon. Would I still be allowed to visit up to noon tomorrow, which is within the 14 days?
Yeah, so the way we've been reading it, and we're just processing this information just like everyone else, so when they talk about the staffing testing, they talk about as close to 7 days as possible. And so if it's the 8th day that they are in and they get their test, it's as close to the 7 days. We're trying to keep it 14. I believe that you would not be turned away. As the rules are right now, you need to show the evidence of the negative test in the last 14 days and a test that you haven't been in any situation that would put you at higher risk. So I feel like we're in yellow, we're not in gray level where we're locked down, that we can have a little bit of flexibility around those 12 hours that it takes to be able to get to the next testing day.
Okay. Thank you for the details in that question, Dale, and writing that so clearly. That was made it much easier to respond to and understand. So Colleen is asking, can we still schedule a window visit, as I don't need a COVID test for those?
Yes, and that's why we're looking at how can we support window visits in February. Because that will be aside from virtual visits, that will be the only way that someone who isn't being COVID tested can have that kind of face-to-face with a resident. So we're not sure what's going to happen with outdoor visits. I don't feel super great about wheeling somebody out, a 93-year-old person out in the middle of February to try to find a way to do an outdoor visit. If we can find a unique way, maybe that will come. But we would like to make the window visit a little more comfortable so that you're protected from prevailing winds and snowstorms and still can come to the window and have that visit.
Mm-hmm. Well, I imagine you want it to be a somewhat enjoyable experience for everyone involved.
Yeah.
Safe, of course, too.
Yeah, and we know people want to bring some families and new babies and that kind of thing. And so the group can come to the window and people can wave and you can talk with your phone through the window. And if we can have a bit of shelter, then that's what we're looking to do.
Okay, and then clarity for in-person visits. Jen, are one-on-one visits supposed to show proof of a negative COVID test, as we do hug residents before and after the visit?
Yes, so the directive does say indoor visits must show proof, as well as DCP visitors. And I will share it in the summary, but I just will highlight that right now, the way the rules are in orange, red, and gray, indoor visits and general visits are restricted. So they stop those. And as I've said to everyone over the months, our goal is that DCPs will not be restricted, as in excluded completely. If we escalate into red or gray, the access by DCPs might be limited. So instead of 2 people able to come in at one time and not have to pre-schedule your appointments, if we're in gray, it may be 1 person, 1 DCP, and you may have to book it ahead just so we can help control the numbers. That's just what we're thinking to be able to support the rules and still support the residents.
Well, here's hoping everyone follows Dr. Era's 3 W's and we don't get into any more serious categories here, but I'm sure we have a lot of DCPs who are relieved to hear that we're going to try to keep that going if it does turn out that way. Can a resident turn down a visit that's been booked by a family member? Are they given an opportunity to say no to a visit?
Yes, the resident gets to decide what they do and who they see. We'll do our best to communicate that and have a good conversation about it with the resident and with whoever we have to phone to say the visit's not happening today. But yes, they get to decide.
I've been tested at the Hanover Hospital and go online for my results. Is that the same way to see my results after being tested at Rockwood?
Yes.
Is there any chance of getting the rapid tests that we've heard of instead of the nose swabs?
Oh, how we all are on the same page, longing for a test that doesn't touch the back of your brain. Yep. So at this point, I don't have any more information about the rapid testing other than I'm keeping my eye on it. And if we can get into a pilot or be a part of it, I'll do my best.
Michelle is suggesting maybe we could look into ice huts for window visits as an option.
It's a good idea. I know someone else said that, ice fishing huts. And I've seen in Thornbury, there's these bubbles that are around outdoor patios. So there's a few different options we're looking at.
Great. Is it still necessary for a DCP to take the 15 online health and safety courses in order to go into our loved one's room?
It is still necessary. You only have to do it once and then check your email for updates. You do have to review it monthly. That's a part, you don't have to do all the courses monthly, but you do have to review the policy monthly. And whether this isn't probably what you want to hear, but we've also added a very short education based on feedback for DCPs about what to do in an emergency situation like a fire drill or a fire alarm. So code red, code green is evacuation, code black. So the new presentation goes over what to do as a DCP when you hear one of those codes called. And that was some really good feedback from some DCPs at Lee Manor who have been there for fire drills and weren't sure what to do. So I really appreciate getting that feedback. So yes, if we can find a more streamlined version of the IPAC, the Infection Prevention and Control Training, we will implement it. but it is really important that when you're in the home, at the bedside, essentially part of that care team, that you have a solid foundation of understanding about how infections are transmitted, what to do to prevent that. And so that's why we do that training.
Okay, thanks for that, Jen. If testing weekly, will DCPs have to wait 3 days to see their loved ones before their results come back? This will only allow a couple of days to visit in between tests.
No, we're going to try to make it as streamlined as possible so that it doesn't impact your ability to visit.
Very good. Okay, looks like we are getting low on questions here. So if there's anything we haven't gotten to, please do put that in the Q&A as we have some time left if we need it. There's one in here that I think is specific to how we care for elderly patients with dementia. Are you able to comment on specifics about that type of care, Jen? Or the case-by-case basis?
I can.
Sure. So it's regarding chemical restraint.
Oh, chemical.
Yeah, and when that.
So, yeah, there we get outside of my.
Yeah.
Yeah, I can say we are a least restraint facilities or homes, and we have, thankfully, I'm not trained as a nurse, but we thankfully have very skilled, clinically trained staff. And our goal is always to use medication as a last option. And we look at other non-medical interventions for supporting people with dementia before we get into the medical interventions. And it's always in partnership with a pharmacist and the physician.
Okay, thank you very much for that. Will there be staff on Christmas Day to facilitate virtual visits with loved ones if they can't come out?
Yeah, that's a good question. We need to be looking, those are some of the things we're looking at. How can we support Christmas in a different way? And I think that's, we'll have a little bit more information a little bit closer to the time about what does that look like and how can we maybe spread visiting around, because our structure also won't necessarily be able to support hundreds of virtual visits. So we need to be able to manage that and make sure everybody can have their opportunity. But one of my colleagues out has just sent me across the World Wide Web, which is great, that Rockwood for sure has 3 staff on Christmas Day to support virtual visits. And I'm sure that's reflective of the other 2 homes as well. But yeah, so we know it's important, and we also need to be able to balance the volume. So we might see how we can spread that out over 2 or 3 days.
Okay, very good. Colleen says, big thank you to the staff who held on to Christmas decor. That I had taken in to decorate my mom's room. Great collaboration, and it went smoothly.
Awesome.
Right. What are some good options to provide the staff with some type of thanks over Christmas? Candy is great, but maybe not always good for the waistline, and we don't want to miss anyone. Do you have any suggestions, Jen?
Oh, that's so nice. I'm sure you've seen on social media and different news and stories about long-term care and healthcare workers. And I mean, we're over 9 months in this. And so the appreciation and the gratitude that we feel from you and the residents, it really is the fuel that gets us through. And we've talked about how the pandemic isn't a sprint, it's a marathon. And a week ago or so, I was joking that we feel a little bit like we're running at night and we're out of Gatorade and everybody that was cheering on the sidelines have gone home. But that's not true. And we do appreciate the comments and the feedback and that support that you do give us. So off the top of my head, we did have a little bit of discussion about this. So chocolate is always, and candy is always very appreciated. One thing to think about is if it's individually wrapped, it fits into our health and safety and infection control protocols a little bit, as opposed to the community chocolate box. So that's an option. And why don't I put it on my list that when we do the summary, that I'll see if I can put a few ideas. I'm not sure. So like the United Way had a campaign at the beginning of
Fueling
the pandemic. Yeah, fueling frontline. And I don't know if that's still happening. So I'll look into that and see if there's a way of supporting our local businesses and showing gratitude to the staff, which was what that Fueling the Frontline program was kind of all about. So I'll look into that and communicate that back out to everyone.
There's a comment here that someone had taken in coffee pods, and that was very much appreciated.
Great, that's a great idea.
Yeah. Dale loves the DCP program and is crazy appreciative for the first floor team and for all staff. Huge thanks. Can a DCP take in their own iPad on Christmas to facilitate their own virtual visits with family?
Yep, I think that's a great idea. And so I'll also add to the list Wi-Fi access.
Public Wi-Fi, yes.
Yeah. So we'll get that sorted out and figure out how to put some posters up so that people know how to access the public Wi-Fi.
Great suggestion, Michelle. Thank you. So we were told we could not bring any food for staff. Please comment. And I think this goes back to your individual wrapped, not homemade food, Jen?
Yes. Yeah.
Okay, I'm not seeing anything else in our question bank. I'm just quick look in the chat. I don't think I see anything in there.
Maybe while you're looking, I'm going to share my screen really quickly.
Sure.
Because I shared this with Committee of Management, which is the council, the county council that is our board, the Long Care Committee of Management. So this information was as of November 10th. But this was really, I thought, really interesting and demonstrates the volume of effort that's happening at all three homes. And so since the beginning until the end of October, those are the numbers of tests and visits and isolation that has been supported over those number of months. And it's, thousands of virtual visits, thousands of window visits, thousands of indoor visits, thousands of COVID tests. So, and also just to demonstrate that there is 2 or 3 residents that are being supported in isolation in the homes at any one time, whether it's as a result of a new admission, so they've moved in and that's a requirement, or because we're very vigilant about our surveillance of symptoms. And so if anybody has a symptom, they're isolated, supported in isolation, and tested until those test results come back, and then we're able to suspend the isolation, or we follow the direction of public health. But that's a significant effort, and it has its toll on the residents as well. And so I thought it was important that we gather the information and that we share it back with people so that they know what's happening, and so that they also can have a look and just see what they've done to support these initiatives of keeping everyone safe. So I just wanted to share that.
Well, thanks very much for that. Staff have been very busy supporting residents and their families and making sure that we have these connections that we all know are so important. I'm not seeing any other questions or comments. I will remind everybody, if something else comes to you, you can email communications@gray.ca, or you can reply to the newsletter that we send out. That would come to me as well, and we will respond to your question as best we can. As well, when we send our follow-up out, I'm going to include a recording of this video, and feel free to share that with anyone in your family or your neighbors that you think are interested in this, who have a person they love in Grey County long-term care. And was there anything else that you wanted to add this evening, Jen?
I just wanted to say thank you. And I was trying to remember the 5 W's are: wash your hands, wear a face covering, and watch your distance. So do all of those things, and we will get to the finish line together. So thank you.
All right. Thanks everyone for joining us tonight. Have a good rest of your evening.